Okay, so for grade 0 and 1 of forearm supination, you're going to have the patient's elbow bent. You're going to hold onto the elbow and you're going to palpate the supinator muscle. You're going to ask the patient to bring their palm up towards the ceiling. For grade 0 and 1, there'll either be no palpable contraction or there'll be a slight contraction. For grade 2, the patient will only be able to complete partial motion of the supination. And then for grade 3, I'll have you supinate your hand up towards the ceiling. Perfect. So that's complete range of motion. So this time I'm going to have you do it, and then I'm going to add some resistance. So don't let me bring your hand back down, okay? So go ahead and do the motion. And then, nope. Okay, relax. So for grade 0 and 1 for forearm pronation, patient's elbow is going to be bent. You're going to be cradling the elbow. You're going to be palpating the pronator teres. You're going to ask the patient to turn their palm down to the ground, and you're going to feel for a palpable contraction. If there is none, it's grade 0. If there's a slight contraction, it's a grade 1. So for grades 2, they're only going to be able to complete partial motion. So put your palm down, and partial motion would be right about there. So for grade 3, go ahead and turn your hand to the ground. Perfect. Keep your elbow bent. Okay, so for grades 4 and 5, I'm going to have you do the motion, put your palm facing down, and then I'm going to add resistance, okay? So don't let me bring your hand up. 2, 3, 4, 5. Okay, relax. Good job. Okay, so for wrist flexion, you're going to hold the patient's wrist, and you're going to assist it in flexion, but then ask the patient to try to flex the wrist, bend the wrist towards them. For grade 0, there's going to be no palpable contraction. Grade 1, there's going to be a slight palpable contraction. Grade 2, the patient will be able to only partially flex the wrist. There you go. And then for grade 3, I'll have you bend the wrist all the way towards you as much as you can. Perfect. And relax. Grade 4 and 5, I'm going to add resistance. So go ahead and bring your wrist towards you, and don't let me bring it down. Perfect. So for wrist extension, you are going to support the hand and forearm on the table, and you are going to palpate any contractile activity for grades 0 and 1. So I'm going to have the patient try to bring their wrist up towards them, okay? Perfect. But if you were a 0 and 1, you wouldn't be able to do that. That's okay. Okay, so for grade 2, they will complete full range of motion with gravity minimized. So what we're going to do is we're going to turn your arm this way, and then go ahead and just bend the wrist up. Perfect. Okay, then for grade 3, we're going to turn your arm back this way, and then you are going to bring your wrist up towards you. Perfect. Relax. Okay, one more time, and I'm going to add resistance, okay? Go ahead and perform the motion. 1, 2, 3, 4, 5. Okay, relax. Okay, so for knee flexion, you're going to hold the distal part of the leg. You're going to palpate the back of the knee for any contractile motion of the tendons. So for grade 0, you'll feel nothing. Grade 1, you'll feel slight contraction. So go ahead and relax. For grade 2, it's going to be side lying. So if you could please roll onto your left hip facing that way. Perfect. So what I'm going to do is I'm going to hold your leg. Okay, go ahead and give me dead weight. Relax. So I'm going to hold you right here. And what you're going to do is you're going to try to bend your knee, but since it's a grade 2, the patient's only going to be able to complete partial movement. So go ahead and try to bend your knee. Okay, perfect. And relax. Okay, go ahead and lay down on your stomach. Okay, so with this leg, with your left leg, go ahead and bend the knee as far up as you can. Perfect. Back down. That's a grade 3. Okay, now I'm going to add resistance. So go ahead and bend the knee, and I'm going to resist you. Don't let me bring your foot down, okay? Perfect. Go ahead and relax. So for grade 0 and 1 for knee extension, you are going to palpate the quadriceps tendon, and you're going to ask the patient to try to extend their knee. And if there's no contraction, it's a grade 0. If you feel a slight contraction, it's grade 1. So for grade 2, I'm going to need you to roll onto your right hip facing that way, please. So side lying, I'm going to cradle the leg. So I need you dead weight. I'm going to have your leg here. And I'm going to have you try to extend your knee. Perfect. So partial range of motion would be a grade 2. And go ahead and relax. Okay, so for grade 3 knee extension, I'm going to place my hand right above the knee, and I'm going to ask the patient to bring the foot up to the ceiling and extend the knee. Perfect, and relax. So for grade 4 and 5, now I'm going to add resistance, so go ahead and bring your foot up and don't let me push it down. Good, go ahead and relax. Okay, so for ankle plantar flexion, you're going to have the patient prone and you're going to palpate the gastrocnemius, and you're going to ask the patient to try to point their toes, and you're going to feel for any contraction at all. If you don't feel anything, that is a grade 0. If you feel slight contraction, it's a grade 1. So for grade 2, okay, so for grade 2, I'm going to brace the ankle, and I'm going to manually give resistance to the foot as they try to point their toe. So go ahead and point your toe, and don't let me push your foot down. And relax. Okay, so for grade 3, 4, and 5 for ankle plantar flexion, grade 3, the patient would be able to bring their heel up and hold their body weight, but only one time. So, sir, if I can have you raise your right foot, and then go ahead and raise your heel off the ground with your left foot. All the way up, and go ahead and go back down. So that would be a grade 3. So grade 4 is when you can complete anywhere between 2 and 24 heel raises of at least 50% of initial heel raise height at a consistent rate. So go ahead and raise your heel as many times as you can. Perfect. All right, go ahead and relax. Okay, so for grade 5, the patient would be able to successfully complete 25 heel raises through full range of motion without a rest between raises. So go ahead and begin. And relax. So for foot dorsiflexion and inversion, you're going to palpate the tibialis anterior. You're going to ask the patient to try to bring their toes to their nose, but also bring their inside of the foot in. So for grade 0 and 1, grade 0, you won't feel any contraction. For grade 1, you'll feel partial contraction. For grade 2, you'll ask the patient, try to bring your toes to your nose and bring it in, and they'll only be able to complete partial. Okay, perfect. So now, for grade 3, you'll ask them to complete the motion and in. Perfect. Go ahead and relax. So now for grades 4 and 5, we're going to add some resistance, okay? So go ahead and complete the motion, and I'm going to resist you, okay? So I'm going to try to bring you in and down. Okay, relax. Okay, so for foot inversion for grade 0 and 1, you're going to palpate the tibialis posterior, and that is between the navicular bone and the medial malleolus. So what you'll do is you'll ask your patient to try to bring the inside of the foot in. So you'll go ahead and try to do that. And I'm looking for any contractile. So 0, you'll feel nothing. 1, you'll feel partial contraction. For grade 2, I'll ask the patient to try to bring this foot in. And if they can only do partial, that's a grade 2. And for grade 3, they'll be able to complete full range of motion. Go ahead. Perfect. So now I'm going to add resistance for grade 4 and 5. So don't let me bring your foot back out, okay? Go ahead and bring it in. And 1, 2, 3, 4, 5. Okay, relax. Okay, so for foot E version with plantar flexion, we're going to ask the patient to point the toes down and try to bring the foot out. So we're going to palpate just below the lateral malleolus, and we're going to palpate the peroneus longus and brevis. At grade 0, we will not be able to palpate anything. At grade 1, there'll be slight contraction. For grade 2, the patient will only be able to complete partial motion, so go ahead and point your toes and try to bring your foot out. Perfect. Relax. Okay. And grade 3, they'll be able to complete the whole thing. Go ahead. Perfect. Okay. So for grade 4 and 5, I will be applying some resistance. So don't let me bring your foot back in, okay? So point the toes, bring it out. Okay, and